Welcome back to the Nutrition Made Simple podcast, powered by Healthy Steps Nutrition. At Healthy Steps Nutrition, we believe something as fundamental as nutrition shouldn't be complicated, which is why we focus on a simple, habit-based approach. We know that helping you become the best and healthiest version of yourself isn't just about what you eat or going to the gym a few hours a week. We have to focus on a holistic approach, addressing nutrition, stress management, mindset, sleep support system, and lifestyle. My name is Nicole Aucoin. I'm the founder of Healthy Steps Nutrition, home of CrossFit HSN and HSN Mentoring. In this podcast, we're going to teach you how to take one step at a time to make health a way of life so that you can prevent and reverse chronic disease. I'm super excited about today's podcast guest. She has been a friend of mine for over 20 years. We actually went to college together, and her name is Ashley Martin. She has been in the ER as a nurse for over the past 10 years and has made a transition into preventative medicine. She is opening up a concierge medical practice now as a nurse practitioner in Jacksonville, Florida, but helping people all in Florida. Super excited for her to share her story, what she's learned working in the sick care side of healthcare in the hospital, in the ER, and now what she's doing on the preventative side. Hope you enjoy this podcast episode. Ashley, welcome to the Nutrition Made Simple podcast. I'm so excited to have this conversation today.
I'm so excited to be here.
Oh my gosh. Well, first we have to share a personal story. You were actually the person who introduced me to CrossFit. We've been friends for, I won't like to say how long, but it's been close to 20 years now. And in 2010, probably earlier than that, when did you start CrossFit?
I started in 2009.
Okay, so for a year, you begged me to come with you. Like, Nicole, come, it's going to be awesome. And I'm like, no, all you do is talk about CrossFit. This is a cult. I do not want to go. And then finally, I think I was at your house and you're like, nope, you're coming with me right now. So we went, and you got me hooked on day one doing GHD sit-ups, which is not a good idea. If you've never done CrossFit before, don't do GHD sit-ups on the first day. Your abs will never be that sore again. But I just want to first start this off by saying thank you for introducing me to, a community of people and really a way that has changed my life. And thank you.
You're very welcome. However, I do need to clear the air because when I was thinking of the workout to do with you, I was like, okay, this is my only friend that I think I can bring that would really do CrossFit. I need her to love it. She's a high-level cheerleader, athlete, gymnast. So GHDs weren't like baseline. You weren't coming from being on the couch. And I knew you ran because you lived at that apartment that was on a hill, like a Florida hill. But to me, this is like a mountain. And I was like, okay, so she runs, she's a gymnast. I'm not going to get her lifting a barbell like on day one. I need her to love it. So that it seemed to me like the perfect workout. However, you said you died.
I didn't die, and it was great.
And you fell in love. So really, it was the perfect workout.
Yeah, it sure was.
For you.
Gosh, so much fun. Thank you. But today we are talking not about CrossFit, although we probably will share some CrossFit stories throughout. We're talking about the healthcare system. So beyond CrossFit, you have a lot of experience with health, specifically in, I want to say healthcare, more like sick care. Tell me a little bit about your background and what you have been doing the past 10 plus years.
Okay, so I've been a nurse for the past 10 years. I work at a hospital here in Jacksonville downtown, or I worked at UF Health. It's a community hospital. So we deal a lot with homeless, people uninsured. We have a lot of jail patients. And it's been just like a passion to see how the community, that part of the community, how their health is. And in the ER trauma center where I work, we do see a lot of comorbidities, like a lot of diseases that people just aren't keeping up with. So it's been a real big eye opener for me because you can be in the community that we're in, like in the CrossFit community, it seems like everybody's just so healthy. And then you get in our area of the hospital and it's like, whoa, this is going on. So it's a real eye opener.
Let's talk about some of those comorbidities. When you look at the population at large, 60 and some more recent research shows up to 70% of people have at least one chronic disease. So the likelihood of someone listening to this having something that they're struggling with, which basically means you have to have doctor's oversight for at least a year on the condition that you have. What were some of those common comorbidities and chronic diseases that you saw in the hospital?
So we would have a saying there, like everybody has high blood pressure, because we would get patients that are checking in with high blood pressure, and you'd be like, "What is it?" Oh, it's everybody has high blood pressure. It's not a big deal because all our patients did. And then hyperlipidemia, so high cholesterol. They would have heart disease, COPD. Like we saw the whole gambit, and they all kind of just start to mesh together. Once you have high blood pressure or diabetes and it's untreated, you kind of just like kind of roll into all the other diseases that we see. And a lot of our patients were non-compliant, so that's how they would present with just disease after disease.
Yeah. And honestly, I didn't work in a trauma hospital, but my experience in the hospital was the same. It was the revolving door because people would come in, treat the acute condition, but the lifestyle changes were never addressed. So they would be back within a matter of days or weeks or months with another complication because of the chronic disease. And what's interesting to me is that this doesn't just affect the people that you were talking about before. Like healthy people have chronic diseases too. One of the reasons why we started the continuous glucose monitor program is so many research shows that 80% of people with prediabetes have no idea. Like you don't know their blood sugar is chronically high until you start getting your numbers tested regularly to see what's going on in the inside of my body. And chronically elevated blood sugar is the lead one cause or worsens the top 10 causes of death, right? So people with elevated blood sugar are likely to have excess complications like kidney disease and heart disease and all of these other things that are going
All the
on.
diseases, yeah.
Yeah.
And
So
so a lot of these diseases, you can see them like you don't have any symptoms, but you could be walking around with high blood pressure, or high cholesterol is like a super big one that's more genetically predisposed to where you look healthy, you feel healthy, but your insides are, not as healthy as you look on the outside.
yeah, I was just at church this morning and someone came up to me and they're like, "Hey, I need to get my son to see you because he has high triglycerides. He's a college kid. He's skinny. Like, do, doesn't he's not overweight, not struggling, which is usually what you uh, associate chronic disease with, right? Like weight issues, and then it goes down the gamut. But in reality, he's not eating well. He's eating a lot of processed food, a lot of high sugary things, which is causing his triglycerides to go, be elevated, which is going to cause fatty liver down the road if it's not treated. So she's like, we need to nip this in the bud. He needs to come see you so that we can handle this. And I hope that this podcast gets people thinking, okay, maybe I just need to assess where am I at? Like, when's the last time I've gotten my numbers checked to know the baseline that I am so that I know, are my numbers trending every year in a positive direction? Or if we look at the sickness, wellness, fitness continuum, am I going closer to sickness where I'm going to be at higher and higher risk every year for chronic diseases, which obviously we don't want to live our best and healthiest life. Let's talk about interventions with the system. So traditional system where you worked in the hospital, or even think of like primary care practices, going to see your primary care physician. What is the standard of practice there?
So traditional healthcare is you have a problem, you go in or you're getting checked up and it's like, oh, you have diabetes, you have high blood pressure, or you have this disease. Here we go, we're going to treat it. And that's kind of just how it's been going for years because that's, healthcare is such a dynamic, we're always improving. And this is the aspect where that's where it was. Like we can do other things now, but that's where it was, is that you have high blood pressure and this is what we're going to treat you with.
And that treatment would look like,
Medication all the time, typically. So I have all my family is healthcare. And I asked my one sister who's been a nurse practitioner now for over 20, 30 years. And I was like, what is the most frustrating thing about being a primary care? And she was like, well, you have someone come in, you say, I can give you a pill. or you can start dieting and exercising, eating healthy. And 99% of the time they choose the pill, or they say they will diet and exercise. And she said the one time in all her years has she actually had someone lose weight and not have to take a pill, which is like mind blowing to me. Like it's just so
I
much
think
easier, like that instant gratification. I'll take a pill and keep eating everything I want.
number one, processed food's super addicting. So you really honestly need help to be able to break some of those addicting cycles. And I think a lot of times it's not necessarily your fault. There's so much misinformation about nutrition, diet, and exercise, and people need something simple. But when you go to a doctor and they, maybe even scare you, like you need to start changing, you need to lose weight, like that pep talk doesn't do anything when you walk out of the office and you have a million things going on with your life. Like you need an environment change, you need the support, you need, most importantly, accountability to help you see really good results, which is honestly why we created Healthy Steps Nutrition. And I think one of the reasons, so hold on, we need to pause. You are a nurse for 10 years, but you recently are now something else. What happened? You're a
Yeah,
nurse
so I got
practitioner.
into yeah, I'm a nurse practitioner. So I went back to school just to have this extra facet to how I can interact with my patients. So as a nurse, my favorite aspect of it was educating. So you come into the ER, you have the ER doctor comes in, then you're attending, and then like you're a cardiologist, and everybody is just sitting there like telling you how awful or like how awful your health is because you're there, for a reason. And then I would come in and be like, okay, how much did you get? How much of that did you actually understand? So I really enjoyed that aspect of it. But I don't have a lot of time. I can't change someone's life by sitting next to their stretcher while they're having, chest pain and be like, this could have been changed a while ago. I don't have that time. So I did go to school and got my nurse practitioner mainly so I would have another platform to stand on and have more time that I could spend with patients and create those relationships instead of the relationship where I see you at the ER once a month and I know your name and I know your kids' names and it's fun to see you because you aren't taking your medication. And, I just wanted something that had a little bit better um, like a little bit better outcome for it.
Yeah, that you can actually help people instead of just putting a bunch more band-aids on the different problems that are happening and never actually treat the wound, or AKA the habits that are happening, the lifestyle that's causing all of the cuts and issues, complications that people are having. Where do you see there being this bridge between, because let's not take for granted what the value of the ER. Like you guys truly save people's lives there. And I can say from personal experience, I've never been more thankful over the past year for the trauma team, and just from personal experience, like there's incredible work that's done and there's a place for that. But even if you are super healthy, if you find yourself in that situation, you're going to be able to bounce back so much faster if you have a solid foundation of healthy habits in the lifestyle that you need to prevent and reverse chronic disease. Where's the bridge between primary care practices and in the hospital and actually helping someone take control of their health?
So that's where we move from the traditional form of medicine when you get into the hospital, and we move more to prevention, which is more my favorite aspect of it. I like them both, but prevention is just so much more beneficial to find that disease before it gets down the road to where you're going to be in the hospital and you have more negative health outcomes. So the bridge is, bridging the prevention to, just maintaining so that you're not making hospital visits to find out, hey, I'm at higher risk for diabetes or high blood pressure. If I, do this, this, and this, I can make it so that I don't have these negative outcomes in the long run. And that would be, I mean, ultimately, I would love to put the ER out of business, but that's not going to happen because not everyone's going to grab onto it. And then you still have accidents and other things that like little sicknesses and illnesses that come up. But when you do get the flu, once a year, whatever it is, you're going to be so much better off fighting it if you've, gone through the preventative systems and you're keeping a healthy lifestyle. So as long as I don't want to put the ER out of business, it would actually make me money too if you get sick every now and then.
I think it's interesting. Like if we think about even my doctor, going to the doctor, and which soon is going to be transitioned to the concierge service that you offer that we'll talk about in a little bit. But when I go to the doctor and I get my blood work done, I get a phone call that says everything looks good or it's within the normal range, right? There's not tracking that's like, hey, Nicole, the numbers are, you're actually doing better than last time, or the numbers are trending in, the wrong direction compared to last time. It's just the silo. Is it within the normal range? Well, I think a lot of times that's what happens when you go to the doctor. As long as it's in the normal range, you're good. But then it could be trending up, where that's the point that we need to be really focusing on the lifestyle interventions to move it back down so we don't get to the, oh, yeah, everything's within normal range. Oh, nope, now you need a medication. Oh, now you need another medication. And I think that's a big part that comes into what you're going to be doing is really working with people. Because even when I get my blood work done, it's a assistant at the hospital or at the doctor's office that's calling me that says, yep, everything's within normal range. And if I wasn't educated on what those numbers mean and how to turn them around, I would take the medication maybe because I don't know how to fix them other than you telling me I need a medication.
Right. So that it's one of my favorite things. I have people send me their lab work all the time just because I like to like analyze it and be like, oh, did they say anything about this? Did what did they recommend? Even for me, like I just went to hematology and I'm, just to see if my B12 and everything is okay. And instead of like with the healthcare now, you can get everything online or like straight to your phone. So it's great to be able to look it up and be like me and the knowledge I have, be like, oh, I'm low in my folate, like, oh, I'm high in this, like this is great. But if I didn't know better, I just got a voicemail telling me, hey, you need to start taking an iron supplement. And if I like, I wouldn't know better. So it's like, oh, you can also eat different to help that. And um, with like the knowledge I have, it's kind of like baffling to be like, oh, I got a voicemail about it, and like no one ever actually talked to me or saw me in person or like even chatted me to tell me to give me more information and to educate me. Not that I needed it, but
Well, just in general, most people don't know, right? And I want to go through one blood work number that I think everyone needs to know more about and educate themselves and ask to get this tested if they've never really looked at their blood work. A1C. Um, I want to share a quick story about this. So we have someone in the CrossFit community who I was actually on his podcast and we were talking about blood sugar management. And he's like, you know what? I want to do a CGM. I'm like, okay, cool. Let's do it. His blood sugar was consistently high and elevated the whole time. And then he's like, yeah, my A1C just runs high. I'm like, do you mean you have diabetes or pre-diabetes? Like your A1C running high means that your blood sugar is high, which causes more problems down the road. So we don't want our A1C to run high is the moral of this story. And let's talk about what it is. What does it mean?
oh, so the hemoglobin A1C is, I get excited because this is like one of my favorite labs of like the general lab mix. So you go into your doctor. Actually, you're supposed to get this checked at 35. Not that I'm 35, but my general practitioner didn't check it, which is kind of, there's guidelines to where you need all these labs checked. And there's, if I look healthy, no one's going to be like, hey, well, let's test her for diabetes or let's see where she's at. It's not one of the first things. They see me and immediately everyone wants to check my thyroid. They're like, let's see how well she's metabolizing food. But anyways, back to the hemoglobin A1C. It's my favorite because I think of it as like the youngest sibling in the family, which I am. And you go to the doctor and you get your regular glucose checked and it's a little high and fine or it's normal and you can kind of blame that on food, what you did for the day, because it does fluctuate throughout the day. So it's not a good pinpoint of where you're at. But the hemoglobin A1C tells a 2 to 3 month accumulation of where your blood sugar is ranging. So it's more like you go and you tell them you've been eating good. We get your hemoglobin A1C, and that younger sibling is going to be like, no, you weren't. Like, this is where you're at. And that's like how I like to think of it and why it's one of my favorites. Because, as you see a lot of the time, probably is people think that they're eating healthy. And then you like get a little bit more into it and you're like, no, that's not very healthy the way that you're eating. So this kind of brings to reality how well you are maintaining the glucose in your system.
Yeah, because nor your blood sugar normally is going to go up after you eat, right? It's just how quickly does it go down? How fast does it go down? How high is it going up? So we want to see like those ranges. That's essentially what the A1C is saying. Like how high is your blood sugar on average and potentially how low is your blood sugar? I've seen people with completely uncontrolled diabetes because they go low so often where their A1C is not as bad as it should look on paper because of the fluctuations are so high and it's not just all the time high. So A1C, this is one, yes, testing it. This is one that I love to retest within the 3 months because you can see these numbers like drastically improve when you start taking control of your blood sugar. And that's interesting. I didn't know that you standard of care is 35 when in reality, 1 in 3 people have diabetes or pre-diabetes, more than that. And 80% of people don't know it. So you would think that the standard of care would catch up to that and catch people a little bit sooner with uncontrolled diabetes they have to prevent the complications down the road. So we know that A1C, hemoglobin A1C, is essentially a 3-month average of your blood sugar. Let's talk about standard of care, like normal doctor's office. It's high. What happens?
Okay, so you go in, what we learn in school is if it's above 5.6, so 5.6 and below is the normal. If it's 5.7 to 6.4, you're pre-diabetic. So we're going to start you. The first thing they say, first line of prevention is lifestyle modifications. Then we go back to that where you tell someone lifestyle modifications, you come and you check it again and it hasn't changed. And you're like, oh, what are you doing differently? And there hasn't been much. Oh, I like walked for 15 minutes 2 months ago. It's great. So the first line when you're pre-diabetes, once you get to diabetes, you immediately start getting medication. So you try lifestyle modifications. If that doesn't work, then you're put on medication to help lower the glucose run around in your system. And then after you get past when you are diabetic, you're going to be put on like combination medication, 1, 2, 3. And then after you get past a certain point, you move to insulin.
And there are quite a few people that is the route, like that's the standard, that's normal. And what's interesting to me is as you hear doctors talk about, they're like, yep, that's normal. But don't worry, this is normal to be on one medication. Oh, yep, nope, we've upgraded you to 2 medications now. And
Yeah.
the thing is all of those medications are going to have complications. You start feeling a little bit off, but the benefits outweigh the risks in that scenario. And the truth is you can prevent and reverse diabetes. I've seen not type 1 diabetes. If your body's not making insulin, that's another story, but you can control your blood sugar through diet and exercise. You can. And most people just aren't set up with the right tools and resources and support and environment, social and physical environment to help them do that. So you're a nurse practitioner now, and you're going to be doing private practice, concierge medicine. Talk to me a little bit about what things might be different from the traditional system to what you're going to be doing.
Okay, so this is where my passions get to intermingle. So I have a passion for healthy lifestyle, but also I have a passion for medicine. So with Med 360, we want to work more on prevention. And then if we're not able to prevent it through lifestyle and exercise, then we're gonna, build these relationships, talk about what your goals are, and then move on to what we need medication wise. And we're not going to just jump straight through shoving pills down your throat to get you on the right level. But if it does have to progress to that, then that's where we will go. But I feel like with Med 360, we're working on making that relationship, educating you, finding out exactly where you can make changes and then, make this whole plan to make you have a healthier lifestyle, live longer and healthier.
Which is amazing. I'm super excited about this because the traditional doctor's office, you're spending 17 minutes on average with a patient. Like that's the national average is 17 minutes that a patient is spending with a doctor. And that's not the way you're setting up your concierge practice. It's going to be a lot more in depth so that you can really talk about all of the things that are going on so that people know exactly what they need to do. And then you pass them off to someone like a coach to provide the accountability that they need to make the lifestyle changes so that ultimately people can take control of their health and prevent and reverse chronic disease. You talked a little bit about Med 360, which I am super excited about. We are actually, Healthy Steps Nutrition is creating a partnership with you, which is going to be so much fun for people that are looking for concierge medicine. Talk to me a little bit about that. Like, what is for people who've never heard of concierge medicine before, what does that really look like for someone listening?
So it's more, like I said, it was more of a personalized, making a relationship with you instead of going and create like my primary right now. If I want to get in with her, it's a month and a half out. And that's when I'm motivated to see somebody medical wise when I'm not actually sick, which I feel like for people our age, you got a lot going on. You don't want to just, go in and sit in a waiting room to see a doctor. And if you do have that type of like, I need to do this, you have to wait a month and a half, and then it gets like kind of prolonged, at least in my book. So with the concierge program, you don't have to have that such a long wait. We can get with you, make that relationship, find out what's going on. You don't have to sit in a waiting room. We can go from there. And from the preventative standpoint, we can make this whole health plan on how you're going to live the healthier lifestyle. But then down the road, flu season comes up, or you get bronchitis, or you have a UTI, like you don't want to leave your home. I wouldn't want to, and also you don't want to go out and, infect the rest of the population. So that's where we can, make it more streamlined so we can get you tested, send you tests, get you something that can help you recover and save you all that time that it would take to, time and money, because you would be going to the urgent care at that point if you need to see someone right away. And just to, create those relationships and be there when you need us.
I'm super excited about this. It'll be an annual fee for people. We have a special rate for people coming through HSN for the concierge program. People are going to have a few visits annually with you. And then there's those like, I'm sick visits, like checking in. People can make an appointment. You can give them the medication that they need. I mean, I feel like for that alone, I think about when I'm not feeling well, how long it takes me if I actually go to the doctor to get what I need to get better. If I had someone that I can go to quickly and kick the thing in the butt, I'd be back to work so much faster and more productive so much faster. So I'm super excited about that. For people that aren't ready to jump into Med 360 Concierge yet, we do have a jumpstart package I'm so excited about this for you, but you have a jumpstart package. And the goal of that is to help people get a baseline of where they are, because in reality, I would venture to say 80 to 90% of people listening to this podcast have no idea what their numbers are. Even things like vitamin D levels, which are really important to know for mental health purposes, risk of cancer, and a lot of other chronic diseases. You probably don't know the baseline that you're at right now to know how to improve those things. And you definitely don't have a system set up to help you with the lifestyle intervention piece. So you've got the Med 360 kind of jumpstart package for people to work with you, but then also get paired with a Healthy Steps nutrition coach, either at our HQ location or another facility in Florida that's partnered with you as well, to help with the baseline and then the intervention piece. Talk a little bit more about that.
Okay, so we can say we have this jumpstart. So how it works is it's kind of a 3-step process. We'll have a discovery call where we start that relationship, find out, your history, what's going on, what are your goals, how are you feeling, You brought up the vitamin D. When I had started CrossFit with you back in the day, that was like the healthiest I'd ever been. And I actually paid a side lab to do my blood work and found out I was super low in vitamin D. I was super low in folate. And I was like, how can this be? I'm like my peak level possible. And I could still do improvement. So like I felt good, I looked good, or I thought I did
You looked good.
Not like in a conceited way. But so it's really to find out those goals, like so back to the discovery call, 30 minutes. We find out everything that you're looking forward to. And then the next step is we would get your labs done, find out where you stand. This is going to be the super exciting part, find out what you don't know about yourself and then create a plan. So then we're going to get back together with you. We are going to get back together with you and or one of your nutritionists and sit down and really think, like, say, this is where your labs are. This is what needs improvement. This is where you're doing good at, because you have to encourage people at some point. Like, you're doing so good here,
Yeah.
and together we'll make a plan to moving forward, how to go, and then we would see you again. Try it out for 6 months and then find out, how did things improve? That's going to be the even more exciting part. Like, what did we do to actually, improve your health? And that's what I'm looking forward to the most, seeing people that have gotten healthier and when they thought they were healthy to begin with, or didn't know that they had an issue and still help nip it in the butt.
I'm super pumped about that because typically annual blood work, it's annually, right? And if you're working really hard, you want to be able to see those numbers improve. And so you're going to do an initial test with people. They'll have a consult with you and the dietitian, nutrition coach. That coach is going to take them and provide the education, really the accountability from the plan that you create with them. So accountability and support. If they need some medications, okay, you can get them started on whatever they need, but lifestyle interventions the primary focus here. And then retesting within 3 to 4 months, which is typically when we'd recommend to retest after someone's been doing lifestyle intervention. I can tell you that I'm just excited to see these numbers because we don't, historically with HSN, we don't have a streamlined way an easy way for patients to retest, our clients to retest blood work. It happens like the one-off or organic, not a consistent structured way. We just had a couple that joined our gym in January and they just got their blood work redone at the end of April. And for 4 months, they had been doing nutrition coaching with us together as a couple. They've been doing CrossFit. Their blood work on average improved by over 30%. So
That's
cholesterol
awesome.
going down, triglycerides going down, all of these blood markers started to improve by over 30% through nutrition, no medication, and movement, and also prioritizing stress management, sleep, and all the other factors. But I'm so excited for this program because it's just going to positively reinforce to keep doing the healthy habits, keep doing the hard things and staying consistent. Because if you see your blood work going where you're moving in the right direction, and drastic changes can happen in 3 months, like 30% improvement is really good in my book for blood work, for sure.
Right. And then you look at that and how many years of life have you given? Like, how many extra, that's at least where my mind goes. If you've increased by 30%, like, how many extra years is that? Like, that you get to see grandchildren, you get to like do all those things later in your life at an easier like level than you even knew was an issue before.
There was a study done in Britain, and it looked at this like over 100,000 people and what were the common factors for people that lived an extra 9 chronic disease-free years? What were the factors for those people? And I'm sure you could guess this, but for like the number one factor was BMI. How is someone's height versus weight? Now, I believe that it's not the best indicator of health status if we don't take into account muscle mass, but there's still some validity with that marker. The second thing was alcohol, physical activity, and tobacco. Like those things were kind of really close. But basically, if someone wasn't drinking crazy, really minimal alcohol consumption, not having tobacco, daily movement, and their BMI was in a good place, 9 chronic disease for years. And you just said it, like that's the end of your life when you're hopefully retired and enjoying the fruits of your labor and being able to live your best life with the people you love. So I don't know who wouldn't want to do that.
Right. And you put it like that instead of scaring people like, oh, you're going to die at a young, or you're going to, develop heart disease. If you put it more in a positive aspect of like, oh, you can see like your grandchildren get married, or like, at least that's how my approach is finding something more positive to motivate than going the negative aspect way.
The way I think about it is the current system's like a hamster wheel. You're in it and it's a revolving door and you just keep getting more and more medications because you're not addressing the root cause. And with a program like yours and pairing it with the lifestyle intervention coaching, you're able to get off that hamster wheel and honestly own your health, like take control of the numbers that you can control. And while we can't control everything, we can control the foods that we're eating, how we're sleeping, alcohol that we are not drinking, daily movement. Like we can control a lot of things that are ultimately going to impact our health.
Right.
Any final thoughts today? Well, first, where can people find you? How can people find you?
So you can find me at med360concierge.com. I realize concierge is a little difficult to spell for some people. So it's CONCIE. So I before E, except when you're talking about med360. Medconcierge.com. And no final thoughts for me. I'm just so excited to be on here and to finally set the record straight on the initial workout that I made you do in CrossFit. And how we should probably do it again now, almost 15 years later. Wow, 15.
I am coming to Jacksonville soon, so maybe this coming weekend for the CrossFit Affiliate Summit is the time that we do some box jumps, GHD, and running with a plate. Why you would make me run with a plate, I don't know.
Was there a plate in that? I didn't even remember.
I am scarred forever. I've never
run
with a plate brutal. Since. Awesome. Well, Ashley, I'm so excited for you. I think it's really cool that you are getting out of the traditional system. While obviously there's still a really big place for that, being able to help empower people, to educate them on where they're at right now and what they can control, that they can do to improve their health markers so that they can ultimately prevent and reverse chronic disease. I'm excited for us at our HQ location to be working alongside you. If you are interested in this program, either the Med360 Jumpstart, where she is going to give you a sit down and talk virtually. And also, we probably should mention this program is for people in Florida. So in person or virtual in Florida, if you are not in Jacksonville, close to Ashley, that is okay. She can still work with you. But if you are just looking for the Jumpstart or you are looking for more of the concierge service, both would be really good options to look into so that you can ultimately take control of your health and have a healthcare practitioner on your side who is really focused on prevention instead of just Band-Aids and treatment.
Perfect. Going live July 1st.
I hope you enjoyed that podcast episode with Ashley. I love the way that she simplifies medical labs and helps people understand what they need to do to start to move the numbers in the right direction. When you go to the doctor, they say, this is normal, giving you all these medications. But what if normal, and I use that in air quotations, isn't necessarily the way that you want to go to take control of your health? If it's been a while since you've done blood work and you want to partner with a healthcare provider who's really focused on lifestyle interventions and helping you make health a way of life instead of putting a ton of Band-Aids over, root causes that are going to cause more problems down the road, Med360 would be a great option for you. This program is launching July 1st. You can click the link in the show notes to add yourself to the wait list. I'm super pumped about the concierge practice that she has. HSN clients are going to get $1,000 off the annual membership for the concierge practice. She also has that jumpstart practice if you're just looking for lab values, interpretations, and some next steps there. My recommendation is that you pair this type of medical assessment with health coaching to truly make health a way of life. Hope you enjoyed this podcast episode. We will definitely have Ashley back to talk about all things medical coming soon. Don't forget to subscribe, leave us a review, and we'll see you back here next week.